And I guess it's safe to assume that most of the problems that were resolved, took care of a lot of the customer service issues that we had at the time.
Yeah, that's the thing is that, the customers start getting happy. They start seeing turnaround times dropping. They start seeing more consistency. We ended up with SuperPACS as being addressing as many of the needs as we could possibly find, as far as integration with client systems, integration with between risk packs, voice recognition, all the things that we needed in a one-stop environment. And so SuperPACS, they have the streaming capability to move images. They've got the built-in voice recognition. Kind of tied it all in together, and that's what we were shooting for. Yeah, he always just likes to walk in and say, "So it's working, right?" That's all I want to know, is that it's working.
And at the end of the day, that's what the client wants to know.
Yeah, and that's the thing, is that it's my goal to make sure that happens, and that's why I chose SuperPACS. The radiologist feedback on SuperPACS has been really good, actually. We've had a number of guys call in and say, "Hey, this is one of the best systems I've ever read on. This is, it's really simple and everything works well." And that's important to us, because recruiting radiologists is difficult. You want to make sure that they're happy, that you keep them, they function well, that economically they're making as much as they possibly can, that they're as efficient as they can be, and that they're happy with the system. And so that's been a big win.
Their productivity should increase.
Right. Well, and that's what we're seeing, is that we're going from, where we had a bunch of disparate systems and I could only assign a doc to maybe 2, maybe 3 hospitals maximum. We're now getting to this sort of broader base where they can handle more facilities. They're able to maximize their time, their effectiveness, their economic goals are being met. Our economic goals are being met, so it all really meshes in well. And that's probably more than anything where we've seen some of the early wins, is the physician's satisfaction with the system.
And that should translate into higher productivity.
Well, that's the thing, is that one system connected with all of our facilities allows us to provide overflow capacity, so that, if I hire certain subspecialists to be in the reading center, but they really serve as 2 different functions. They serve one for subspecialty capabilities to our smaller clients that they need it, but they're never going to be able to recruit it locally, or they don't have the volumes to recruit it locally. So they access a subspecialist because of SuperPACS, and then also overflow. So because I'm tied into all the other hospitals' PACS systems during the day, if there's a big emergency, or that you have some kind of disaster or something where the EDs are in overflow capacity, or what happens sometimes is a radiologist gets sick, or somebody's out for a day, and we need to keep the hospital running, and so that's where the SuperPACS kicks in, is because the physician has access to all these hospitals, and we're able to just prioritize them. So instead of working here today, you're going to jump over here. You're going to keep this list clean, and he can monitor it. He can see what's going on with those lists because he has access to them. So it all kind of ties neatly together.